Dr. Pankaj Banga. I'm the Director of Medical Services at Banga Base Hospital. I also am the Director of Medical Services for Sector 2 of Murrumbidgee Local Health District, which is eastern side of the district.
Can you just spell your name for the cameras for us?
First name Pankaj, last name Banga.
So can you just give us an update of where we are in relation to coronavirus here in the MLHD?
As we informed a few days ago, we just have one positive case in the district. We have been testing at Banga Base Hospital and also Griffith Base Hospital, and we have done more than 750 tests, we have assessed more than 750 patients till now, and have done quite a number of tests, but none have turned out to be positive till now.
Till now, so we've done 750 tests in
So
that
we have
period.
assessed more than 750 patients, and we have done a few hundred tests, but none are positive at Banga or Griffith. The only positive case that we have is one in Murrumbidgee Local Health District area.
Given the high numbers that we're seeing in other health districts and including the high increase overnight, would you expect to see more positive tests in MLHD? Is one comparatively low?
Again, going by what we are seeing elsewhere in the state and in the country and overseas, it is likely that more people will test positive in the coming few days or weeks.
So do you think it's only a matter of time until we see one in Wagga?
It's difficult to say because look, our health system is different from what's happened overseas. We are better prepared, but it is likely that we will see cases in the coming few days or weeks.
So you say 750 tests. Have all of those results come back yet?
No,
Are they
so I said 750 assessments and a few hundred tests.
Okay. So only a percentage of those results.
Because all of the people who are being assessed, they don't need to be tested.
And as far as I mean, there is, I guess, talk of people within the hospital who work for the hospital saying that we do actually have positive tests in Wagga. Is that true, or is that just hearsay?
No, as of today, as of now, we don't have any positive cases at Banga Base Hospital.
Do we have enough tests in this region for
Yes.
demand?
Yes, we do.
And in terms of the amount of time it's taken to get tests back, I'm aware of one person it took almost a week. Is that standard? Should it be quicker?
At this stage, all the swabs have to go to Sydney, and then the results come back from there, and the whole of the state has to send swabs to Sydney. So that is why it is taking time.
For the people that have been in contact with someone who has tested positive to COVID-19, what's the protocol? What are you suggesting to them, and what's the contact being like for MLHD with these people?
So if you have been in contact with anyone who has tested positive for COVID-19, the first thing is that you please isolate yourself. Don't go out anywhere. In Murrumbidgee Local Health District area, please ring the 1-800 number helpline, and they will guide you further. In the unlikely event that you are sick or you need urgent medical attention, then you ring the hospital. Don't present to your ED, or you ring your GP.
We've been talking about patients. How are the staff holding?
Look, the staff, all of them are committed. They came into these professions to help communities, especially in this hour of need or in such circumstances. So all of them are committed to doing their best and to providing the best services to the community.
Are we doing okay?
Yes.
Have we deployed any student nurses into our hospitals here in Wagga or Griffith? I know that the state government said they wanted to empower the student nurses to be working in the hospitals. Are they doing that now?
So that is something that we will be doing in the near future.
So not this week or anything, and maybe next week or
Yeah,
past week?
we will be doing that in the near future.
Staying with getting more staff on the ground, we had a text this morning from someone saying that there's potentially hundreds of migrant doctors and nurses who are already in Australia and in New South Wales, but they aren't allowed to work because they haven't passed difficult English tests. Are you aware of that being a case, and if that is a source of medical labour we could call upon?
Look, I am not aware of those details, but we are doing our best to get staff, nursing staff, medical staff from wherever possible, and we spoke about student nurses a minute ago, so that is an option. Medical students are an option. Nurses and other staff who are in non-clinical roles at present, we are contacting them. So we are doing our best to contact everyone who might be helpful.
So would you say the current resources in the area are being stretched quite thin?
Not at this stage, but we are preparing for an influx of a large number of patients. That is why we are doing all of this at present.
So it's
Before
precautionary?
before things become worse, we are preparing now.
We've seen overseas a shortage of space, particularly with regards to some of the clinics and places that you can get tested with symptoms. Are there any plans in place for pop-up clinics here in the MLHD, or what has New South Wales advised across the state?
At this stage, we have 2 pop-up clinics in the district, one at Banga and one at Griffith. More pop-up clinics are being planned along with Murrumbidgee Primary Health Network, and we should see a few of them in the next few days.
One of the things that's been speculated about with regards to the way that China handled SARS was that going into the GPs and then self-isolation within homes was part of the spread and part of the problem. Is that something that you're planning around as well with regards to people going to GPs and going then home infected?
So what we are telling public is that if you think that you might have COVID-19, or if you want any kind of assessment or advice, please don't walk into your GP surgeries, or please don't walk into the hospital. Please ring us and inform us that you need assessment, and you will be guided through that process. If you are sick, if you need medical attention urgently, then follow the usual processes in Murrumbidgee Local Health District area as of today. But once we set up more pop-up clinics, we will update this further.
But yesterday, one of my colleagues went down to Centrelink, and in the line there was a young pregnant woman who said that all ultrasound appointments had been cancelled, and I'm not sure if that's within the public system, but is that the case?
No, we haven't cancelled ultrasound appointments in the public system.
One question, tests are going to Sydney. Is there any chance that testing could be done here within the Murrumbidgee Health area?
The state government is working on that, and we'll have an answer to that very soon.
We have the capabilities here to test if they were to say
Not
this?
at this stage. Look, capabilities are two questions. So we have the machines which do our regular tests, but this particular test at this stage, as of today, is not available in Banga, and the system is working on that.
Could that not be backlogging the system of getting these results back quicker, if everyone's having to go to the same source in Sydney to get their results positively or negatively?
Look, again, this is what we have as of today, and New South Wales Health is working on getting more testing centres and tests to the regional areas. So that is what I can tell you as of today.
Just one last question. Given how fast evolving this situation is going, are you guys looking at updating the public more frequently moving forward?
So we do these press releases every day, and one of us talks to the press on a regular basis, and so we're already doing that.
What about in terms of hourly or every twice a day perhaps?
Again, we can look at that if the situation changes, but at this stage it will be daily.